So welcome everybody. I think people are still coming in there now at the moment. So we'd like to welcome you all. Thank you so much for coming online and attending this webinar today. My name is Nasa De Burka and I've just started as the Regional HSCP Practice Education Coordinator for the West Northwest. So as you know, today's webinar is shaping our future HSCP workforce, starting with practice education, and it's the first in a series that we hope to run over the coming months. So it's great to see so many different professions registered for today's webinar. I think I counted 16 different professions and over 200 people, and the entire geographical region is represented. So just a bit of housekeeping. The webinar is being recorded and we'll share it afterwards. And we'd really appreciate if you have any comments or questions to use the Q&A section. And while some might get answered today, we will collate and use the feedback to plan the content for our future webinars. There's also a link and a QR code for a survey about today's webinar, and that will be located in the chat, so not in the Q&A, in the chat, and you can fill that out coming towards the end of the webinar. And in case I don't get an opportunity to say it later, just like to thank Anne-Marie Lydon because she organised the webinar. She's put a lot of work in over the last few weeks to get it up and running, so thank you, Anne-Marie. So we have 5 presenters today. They're going to speak for 10 minutes each. And we're just going to run directly from one presentation into the next. We won't stop for questions, so just pop the questions, like I said, into the Q&A, and we'll have a few minutes then at the end to respond to some of the questions. So no more than the attendees today being varied across all professions. We also have a number of different professions speaking today. So we have occupational therapy, speech and language, we have a cardiac physiologist and a physiotherapist. So first up today, I'd like to introduce Catherine Devaney. So Catherine is the HSCP Regional Integration Development Lead, and she's going to speak to us today about how we can learn from regional services, developing practice education to meet service need. So on to you,
Thanks,
Catherine.
Nasa. So I'm just going to share my presentation here. Okay, so hoping everyone can see that. So I guess there's a big focus on the moment on practice education for health and social care professionals. This is a priority for the region, but it's also kind of a national priority, and it's also an international priority as well. We know that there's projected increased demand for healthcare services and that there is projected shortage of healthcare professionals. So that's why there's such a focus on growing our workforce. So to that aim, the government in June of this year approved the creation of an additional 310 HSCP student places. And so far there's a commitment to developing another 141 student places over the next 3 years. So that's going to be a significant increased demand for placements going forward, because we know that placements is a core component of the training of health and social care professionals. So we can see here the prioritized professions, so dietetics, occupational therapy, physio, speech and language therapy, medical science, social work, radiography, radiation therapy, and podiatry. So what that means for this region is we have the ATU Letterkenny physiotherapy program is up and running. So they had their first student intake this year. The podiatry program that is in the University of Galway has increased its student intake. But we don't kind of, I suppose, work in the region in isolation. We're very much kind of dependent on accessing placements in different regions, but also facilitating placements from different regions. So UCC and UCD, the radiography program, increased its student intake, and UCC and Trinity increased its radiation therapy student intake. And they are dependent on this region for placements. And we're obviously dependent on those students for our services when they graduate. And dietetics also, they have increased their student intake for UL and in Technological University Dublin with Trinity. And again, we don't at the moment have a dietetics program in this region, and we are facilitating placements from those colleges. So I guess the big question is this the cultural priority in the region? And I suppose since being in post in January, I've been engaging kind of with managers, and there's some really great examples of services embedding placements within their kind of culture and consistently offering kind of placements, even if staffing levels are low. But then there's other services that aren't currently facilitating placements. So I believe we still have a bit of a way to go to really embed a culture in the region that prioritises the provision of practice education placements. We can see kind of teaching is included as part of the mission statement of the West Northwest region. And it's only by all of us kind of coming together that we will really be able to kind of embed that culture within the region. So placements are kind of key to the development and the recruitment of our future workforce. So the University of Galway has conducted a survey with its recent speech and language therapy and OT graduates. And we will share the results when we get them. We're still kind of, I suppose, working off the preliminary results. The survey was still open at the time of this, capturing these results. So, but 50% of recent OT and speech and language therapy graduates are working in this region, and 63% of them are working in a service in which they undertook a placement. So this is really kind of positive. We know that it is work to facilitate kind of placements, but the students are getting a really valuable opportunity to get familiar with our services and hopefully then to want to return to our services upon graduation. And the HU clinical measurement physiology programs have also kind of looked at where their recent graduates are employed, and 67% of them are employed in a service in which they undertook a placement. So how do we kind of build capacity? Well, we can only do it by working together. It is complex and it really kind of requires wide stakeholder kind of engagement. So obviously kind of your services, HSCP services, managers and the staff working in those services are key to building capacity. We now have the regional HSCP teams in place. So myself, NASA and Anne-Marie are in place, and there's teams in each of the other regions as well. And we work very closely with the national HSCP office because obviously we need to take kind of a coordinated approach at a national level to building kind of our capacity. And then obviously other key stakeholders, so the operational kind of team leads, be that of the disability teams or of our community healthcare services. Also the HEIs, their practice education teams, and we have our practice education working group in the region. So this kind of graph here on the left just kind of, I suppose, speaks to the significant increased demand per placement. So this is just kind of, I suppose, a snapshot. It's looking at student numbers, actually. It's not looking at the blocks of placements that are required. And it's also not taking into consideration the current kind of placements that are provided. So we are hoping kind of, I suppose, to build our capacity in the region for those HEIs that are located in the region. But we still have to kind of, I suppose, keep that commitment to the HEIs that we are currently kind of providing placements to. So we're looking at building capacity, not kind of reducing capacity to HEIs that are located outside of the region. And we can see here on the right, just kind of, I suppose, an overview of the amount of hours that different kind of professions require as part of their training. And those kind of their practice education placements should kind of mirror the requirements of them when they come out working in our services. So we want them to get kind of that broad I suppose, exposure to the different kind of healthcare services within our region. So these are our current kind of members of the current professions who are part of our practice education working group. So we have currently got 9 professions represented. And now that NASA's in place, we will be looking kind of to widen that out to other disciplines. And then we're obviously working very closely with HEIs. We'll also have representation on the practice education working group, and in addition to the Children's Disability Network teams and the Community Healthcare Network managers. So this is some of the work, I suppose, that I've been kind of leading on since being in post. So the Practice Education Working Group was established in May of this year, or sorry, in April of this year. Then in May, we held a workshop with the Practice Education Working Group to identify key priorities to building capacity. One of those is looking at a regional governance agreement. This is going to be really important. So this will enable us to start taking a more regional, proactive approach to the planning of placements, and then to ensure kind of a more consistent and standardized approach to the provision of those placements. So that regional governance agreement was reviewed by Physio OT and Speech and Language Therapy, and it's gone to the University of Galway. And we're hoping we'll get that feedback back from the University of Galway in the coming weeks. And we're also looking at that now with podiatry as well. Obviously, key to kind of building capacity is having an understanding as well around our current capacity. And to do that, we have been circulating a practice education database to get an overview of capacity, and then working with the universities to get an understanding around the demand. And we have kind of reports done up for about kind of 6 of the disciplines. And so that's kind of giving us, I suppose, a bit of a snapshot around current capacity. And Anne-Marie is doing a lot of work leading out on practice educator training as well. So this is just kind of a high level overview of kind of, I suppose, some of the data that's kind of coming back. It's kind of very rough and it kind of, I suppose, hides a lot of kind of nuance. But you can see here for physio, all managers, all services are currently facilitating placements, but there's significant variation in the number of placements that are being offered at an IHA level. I think it's important that we point out, obviously Galway Roscommon IHA is providing the most amount of placements, but they obviously also have more acute hospitals and they have more tutors. So there's definitely kind of nuance in this data, but it does give us maybe some kind of indication of where we can kind of look to grow capacity. And then you can see here clinical measurement physiology, and not all managers are currently kind of providing placements, but some of those managers that weren't able to provide placements last academic year have committed to providing placements in the coming academic year. So obviously, managers speak a lot to the different kind of enablers to building capacity and also the challenges. So something that comes up consistently as a challenge is the workforce. So the impact of vacancies, the need for practice tutors, and the staffing levels is, I suppose, it can be enablers or challenges to kind of building capacity. The physical learning environment is also something that comes up consistently. So that kind of need to access kind of space, both clinical and administrative space for our students. Practice educator training was consistently coming back as an enabler for building capacity. And also we're kind of looking at how practice education can support service delivery. So Anne-Marie has been kind of circulating surveys to different kind of professions to see if we can kind of identify opportunities to do projects or to set up different initiatives that will help with service delivery. So I guess kind of, just to kind of finish up, we're really only at the start, I suppose, of a journey of kind of looking to see how we can kind of build our capacity to meet that kind of future projected need. But it's so important that we do that together, and we really kind of need your kind of input. So, as Nasa was saying there at the beginning, we'd love to kind of get feedback from yourselves and to hear kind of what would help you to kind of build capacity within your services. So thank you very much for listening.
So thanks, Catherine. Lots of information there. I'd say lots of work done, lots more to do. And so we're going to move on now to our next speaker. So our next speaker is Siobhan Ward-Lynch. So Siobhan is a speech and language therapist practice tutor with University of Galway, and she's working in the Northwest. So Siobhan is going to speak to us about how we can learn from regional services, developing practice education to meet our service need. So we can see your slides there, Siobhan, so off you go.
Thanks, Nasa. Welcome everyone. As Nasa just said, I'm going to speak to you about how practice ed can evolve to meet service needs, and in particular we're focusing on telehealth integration and its impact on student placements. So we know the importance of developing practice education to meet service needs has become more evident and more challenging in the face of growing demands for high quality clinical placements. In addition to this, the issues of increased caseloads and workforce pressures that limit accommodating students and the growing diversity in learner needs to be considered. As healthcare services evolve, it's essential that educational frameworks adapt to ensure sustainability and relevance. By doing so, we can enhance the quality of student learning experiences while simultaneously addressing workforce challenges. The integration of educational goals with service priorities not only prepares students for real-world practice, but it also contributes to the efficiency and effectiveness of our healthcare delivery. And this alignment is crucial for fostering a competent and responsive workforce capable of meeting the dynamic needs of our patients and communities. So today we're looking at one of the strategic approaches we've taken in Donegal to align high quality practice ed with service requirements. During lockdown, we collaborated with Galway to co-design a revised placement structure, which we can continue to facilitate. This allows us to allocate resources effectively and continue to support staff in their role as educators. We believe the use of technology in practice ed, such as telehealth, which is a core part of our service delivery, ensures that educational activities contribute directly to service improvement goals, as well as expanding the possibilities for innovation in education, and it reflects realities to prepare students for workforce demands. With increasing demand for flexibility learning and service delivery, remote practice education offers a solution to geographical barriers, which is particularly relevant for us in the West Northwest. It ensures students gain real-world clinical experience. And in our case, in this model, the children that attend our services receive timely interventions regardless of their location. So using Attend Anywhere and WebEx platforms, our model requires the student to join from the University of Galway. The clinician is in Donegal, and the child participates from home or from school. And this triad ensures continuity of care and robust educational supervision, as each participant has very clear roles. The student prepares the sessions and engages with the child. The practice educator, who is the clinician, observes and ensures clinical governance. And the child, with their family member or school staff, are supported to participate in the therapy. And the structure of the model mirrors traditional practice ed whilst leveraging technology. Like I said, the practice educator provides client information in advance of the session, which allows the student to prepare a session plan that is aligned with assessment or therapy goals. This session plan is reviewed by the practice educator and feedback is provided based on the level of the student. On the morning of the session, we do a pre-session briefing where we talk about the feedback they've received, what changes they've made to their session plan, and answer any questions they might have. Then, in the live telehealth session, the student leads the assessment or therapy, and the practice educator supervises remotely. The invaluable facility to provide real-time feedback without disrupting the session receives positive feedback every year, and this is not possible in the traditional in-person placement. Post-session debrief is then a reflective discussion and feedback. As you can see from the table, this is how we use telehealth to deliver a service in Donegal Speech and Language Therapy Primary Care, which the students are involved with. Direct therapy is individual or group, and indirect intervention is in the form of parent or carer education workshops and webinars, as well as case history taking. When we first started in September 2020, Donegal Speech and Language Therapy Service facilitated the first remote SLT placement in Ireland. We facilitated 5 NUIG students, now known as University of Galway, in paediatric primary care and in CDNT. The outcome of this particular placement has been written up and published, and the feedback from students and educators was positive. The model has since been evaluated by external examiners and deemed as effective as face-to-face placements. To date, we have facilitated 28 students from Galway for remote placement. This academic year, we have 5 practice educators opting to facilitate this type of placement. Now, it is important to note that remote placement should not replace in-person placement, but the international research and our experience suggest that a hybrid approach is most beneficial. Some of the benefits of the hybrid approach aligned with service needs have also been already mentioned, but here are some more. It not only increases placement capacity as there's no clinical accommodation required, but it also equips the students with real-world experience and knowledge necessary to meet service demands. Their enhanced digital competency for these future clinicians is of huge importance and value. Reduced travel time and costs for both service users and the students, and there's also cost saving for the organisation. Access to services for children, in our case, in rural areas, and enhanced service delivery and improved outcomes as the students contribute to meaningful care provision. Service user feedback is also positive as families can attend appointments with little disruption to daily life. Practice educators also report more flexibility with this model. Now, that's not to say that there are no challenges. Digital literacy and connectivity are sometimes an issue. Some might say that maintaining engagement also needs to be considered. However, clinical judgment should be used in identifying suitable candidates for telehealth services, and digital resources and tools can be used to improve engagement for both the service user and for the students. Student supervision also requires thoughtful planning and coordination, but as always, it offers significant potential to enhance both student learning and service delivery. And again, we can use digital tools to enhance that learning for the student. And by embracing this approach, we can create a more resilient and responsive practice education framework. Finally, I'd like to bring your attention to this valuable resource. The TP project was developed by our SLT colleagues in Trinity, and it's available on the Teaching and Learning Hub. We'll put a link into the chat. As well as the essentials you see here, there's also telehealth session plan templates, guidelines for professional social media use, and lots more. So here are the references, and thank you for listening.
Thanks very much, Siobhan. Very interesting talk there, and definitely a way that perhaps we can implement increasing placement capacity across a number of professions. So next up we have Lorna Doran. So Lorna is the Practice Education Lead working with the Technological University of Dublin, and Lorna's presentation today is on shaping our HSCP workforce, starting with practice education placements. So we can see your slides there, Lorna.
Can you see my slides?
Yep, we can see your slides
Great.
there.
Thank you so much. Good afternoon, everybody. Thank you very much for that introduction. My name is Lorna Doran. I'm Practice Education Lead for Technological University. And yes, I am going to be talking to you about shaping our future HSCP workforce, starting with practice education placements. I can view this from a unique position with multiple lenses, because not only am I a practice education lead, responsible for placing 140 students per year in clinical measurement physiology, I also am a cardiac physiologist myself who had students working alongside me during my time within the acute hospital services. I also work as part of the HSCP team, working nationally to facilitate practice education workshops, the Anne Parker Practice Education Workshops, so understand things from your perspective as HSCPs. And of course, I too was a student myself, as all of you were. I also work with students in the university and receive their assignments on their reflections about placement. And it gives me a deep understanding of what it's like to actually be on placement and what it means to a student to actually have a placement. So I'll just move on. Excuse me. So as we know, practice education is a bridge between theory and practice. That academic theory that we learn in our universities to practice or experiential learning. It's a bridge, not a barrier. And that's one of the things that we've got to remember in the scheme of shaping the future. Now, there are multiple stakeholders which are already been mentioned, some of which by Catherine. We have the government, who's providing, prioritising training places for HSCPs. We've got ourselves, the HSCPs. We've got PECNET, who are the practice education coordinators working nationally for the HEIs to secure and manage placements for students. We have our newly evolved practice education coordinators in the regions, along with the integrated leads. We have the higher education authorities, and we have the higher education institutions. We also have the HSCP office. That's quite a few stakeholders vying or trying to work to make sure that our students have placements, but we have to work as HSCPs with them. And at the centre of all of this is the student. The student just wants that placement so that they can get the ECTs or the European credit transfers to make sure that they qualify. Now, there are 18,700 approximate HSCPs at the moment working for the HSE, not to mention the private sector. They have 146 placement settings with a number of professions in it. Now, this is only related to the HSE. And of course, these are in the primary care, rehab, hospice, disability services, acute, non-acute hospital services, to name but a few. So if we think about the number of HSCs versus the HSCPs versus the number of students requiring placements, if even a fraction or a small portion offered to take a student to work alongside them, we would have more placements for our students. Now, what do our students actually want from the placement? Yes, they need a placement, but there's also standards of proficiencies. And if I can ask you at the moment a couple of rhetorical questions, just to think to yourself about this. On the ground, who is best placed to teach and train about professional autonomy and accountability? Who is best placed to teach a student and train a student about communication with patients and communication within a team, about collaborative working practices, team working and communities of practice? Who is best placed to talk about safety and quality within a health system? Who is best placed to demonstrate professional development? And of course, who is best placed to actually share their professional knowledge and skills? And I think you all know the answer as well as I do. We are, as HSCPs, we know what's going on the ground. We know how to train students for tomorrow's workforce. Now, if I can ask you, please, just to have a think for a moment. Here's a lovely little lake up beside me here in Monaghan, and just reflect for a moment. When you were training, when you were a student, you can close your eyes if you can. Just who do you remember as your supervisor, your facilitator, your mentor, the person who helped you, who taught you, who brought you to where you are today as a qualified professional? Think about that person. Now just think about the place where you worked. Think about the desk you sat at. Which was more important, the space that you worked in or the people who were training you? There are multiple people out there who train students, great teams. There are patients who also have helped students to understand and get a grasp of their profession. We all were learners on a journey from novice to master, but we have to think, even I do myself, think about my mentor, my supervisor on my journey through practice education. And without that person who used to grill me quite often on cardiology, I wouldn't have the knowledge and skills I have now. But what happens is, when we put all of that aside, sometimes we're not thinking about those wonderful people who taught us. We're actually thinking about the barriers to all of this. And there are barriers to placement. And these were defined by the National Health and Social Care Professions Quality Framework, a document that Caroline Hills and Sinead McMahon produced in 2022. And they were talking about, from a scoping point of view, there was some of the barriers were poor time or lack of time where people could not take students. Then there was also the practice education wasn't valued as part of the clinical role. There was also issues in some centres where they had leaner staffing, whereby you may have had those on leave, sick leave, maternity leaves, and they couldn't take students. And of course, then there's the increased complexity of patient cases, where they felt that maybe the student wasn't able to come on placement because of these reasons. And of course, like all of us, there's the efficiency, the waiting lists. Waiting lists will always be there. Our students will always need to have placements. So we need to think about how we can reduce these barriers. Now, there's two ways of looking at this. There's a way of looking at it from the student's perspective. And if I was a student, what would I say to you if you were saying, these are the barriers? If I were a student and you told me you didn't have the time for me, I'd say, well, you know what? I'll make myself scarce when I'm working with you and when you're very busy. This will help me problem solve. It will show me how to be flexible. It will allow me to have that readiness to adapt. If you told me that practice education is really not valued as a part of my clinical role, I'd say, well, maybe I'm not valued either. Or I may also say that, well, actually, this will help me know what it's like to be an authentic, qualified professional, what it's like to have the challenges of taking a student. If you told me you didn't have staff, I'd say, well, listen, I'll make sure I have very clear objectives and I won't be taking your time. This will actually help me to know what it's like to work in a pressurized environment. Please give me a placement. If you said to me, sorry, the patients are very complex, what I would say is that most students absolutely love complex cases. In fact, the more complex, the better for the student. In fact, they just want to know about your professional skills and knowledge and how you deal with those complex cases. If you told me that the waiting lists were long, I'd say, well, maybe if you just let me do some of your job, just the little bits that I could do, maybe I could come on placement for you. I can absolutely show you that there's opportunities for having me as opposed to barriers for having me. Now, if I was to look at this from a perspective of a HSCP, there's also solutions to those barriers, opportunities for you. And one of those opportunities is the Anne Parker workshop, which provides confidence and competence when working with students. And what it does, those workshops remind us that what it's great about taking students. They remind us about how to manage our time and also how brilliant we are as HSCPs. And it also allows us to know the 101 things that students can do on their own without you, and that can help your service. So with all of that said, there are lots of different solutions. And I saw this tractor with a lovely trailer driving in front of me during the summer. I thought, this is going to come in useful at some stage. You know what? This is one of the solutions that we have. They're not always perfect, but just before I finish, think about the student voice. Think about any time is time to take a student on placement. And also think about your abilities as a qualified health and social care profession. You are qualified to take a student. You are best placed to take a student. Be willing to try to facilitate your student, and also draw on the resources that are available from the Health and Social Care Professions Office and now from your regional teams. Thank you.
Thanks very much, Lorna. Very interesting thoughts there, and I suppose refocusing our minds on how we think about students maybe and how important we are as clinicians to help develop the future workforce. So next up we have Olivia Wall. Olivia is the Regional HSCP Practice Education Coordinator for the HSE Southwest. And Olivia's presentation is entitled How to Eat an Elephant, Resources to Help.
Hi everybody, thanks very much. Hopefully that will come up there now in one second. I'm joining here from Cork City today. So I am the Regional Practice Education Coordinator here in the HSE Southwest, and my background is in occupational therapy. I previously worked as an occupational therapy practice tutor in primary care. So I'm sure there's plenty of people on the call already that offer student placements or are managers of services that offer student placements. And there may be people on the call who are hearing a lot about increasing the capacity and quality of student placements around the country and are wondering where to start. So I'm going to try in 10 minutes to try and do a whistle stop tour of that for you today. So Catherine already spoke about over on the left-hand side there about regional practice education governance agreements, practice education governance groups and regional databases. They're all going to help as stepping stones to help to look at how we need to build capacity. I'm going to focus more today on looking at regional educator training and the National Quality Framework for Sustainable Practice Education, which has 8 standards and 6 evaluation tools to support a consistent process and build a student culture and help you to provide a framework for you to do that. So I like to think of it, just to start off, there's 1,000,001 resources to help you, but even just as a starting point is to think about 5 resources. So first of all is the Practice Education Coordinator and the Practice Education team for whichever discipline that you're working in yourselves. Then there's the Quality Framework for Sustainable Practice Education. So as Lorna alluded to, like, that was published in 2022, and we're very lucky that we have a framework or a plan for how we go about this across the country. Number 3 then is there's HSCP practice education workshops or Anne Parker workshops, and they previously were developed nationally and now will be looked at being developed regionally. There's a great resource, the Teaching and Learning for Clinical Teachers, an online learning resource for clinical educators. I'll tell you a little bit about that. And then finally, I'll just finish up to tell you a bit about practice educator education modules, which are freely available on HSC land. So to start off with is this document. So as I said, it was published in 2022, but from the negotiations I'm doing around Cork and Kerry, there's quite a lot of people that aren't too au fait with it and are starting to build up an understanding of what's available within it. So the nice thing with it is that there's 6 different evaluation tools for the university, for a student, for an educator, service user. There's a fantastic CPT tool within it that breaks down different levels of education, and there's a tool for managers. Within the evaluation tool for managers, it talks about the manager's role and that managers of services providing practice placements must ensure that there's a quality review process in place to help build capacity and develop a sustainable model of quality practice placements in their service. And it provides guidelines and structures and tools for how that could be done. When I was working as an occupational therapy practice tutor, it was fantastic to be able to meet with staff and then look at them with regards to which level they were at as an educator. And in this framework, it breaks it down into 4 different levels. So it talks about demonstrating effectiveness as an educator. So that's a clinician who regularly takes students on placement and is starting out, and they're at level 1. It then talks about moving to level 2, about developing excellence as a practice educator, and provides a framework for doing that. Level 3 is somebody who's leading and specialising in practice education, and that could be on their own site or within a region. And finally, then level 4 is looking at influencing and innovating practice education and looking at doing practice education and research within it. Moving on then, so we are talking now about Anne Parker HSCP training. There's another resource, and that's interdisciplinary educator training. This will be available regionally as time goes on. And I suppose I just put up the Kirkpatrick, the evaluation model is at a level 1 reaction is just how somebody responds to training. And I think over time, we're going to have to factor in engaging in training in a region is what benefits has the organisation experienced as a result of the training. So moving up within these levels. So and looking at, I suppose, we are ultimately looking at with expanding the educator training programs and courses around the country and mapping out educator training needs. I'm a practice education coordinator, but I will have a colleague who's a practice development coordinator and mapping training needs, and then looking at how we can work together across the organisation to build capacity and build quality for placements. There's a governance agreement which Catherine had mentioned earlier, and the other resource that's mentioned within that is the Teaching and Learning for Clinical Teachers, an online learning resource for educators. And within the regional governance agreements that have come from the Chief Clinical Officer and now are being implemented through the REOs in each of the health regions, they're saying at a minimum, people should ensure that educators have completed this online training course. So it's an online learning resource for educators. It's free, it's interdisciplinary. It aims to support healthcare professionals involved in the teaching and learning of undergraduate and postgraduate students. And there's 5 free units of learning within it. So what I like about it is it's kind of broken down. People can do it in their own time. Each unit is approximately 40 minutes, but there's loads of optional extended readings and resources available as well. And it provides a certificate of completion on each unit once you exit each quiz. There's modules on the core principles of teaching and learning. There's effective feedback, fundamentals of work-based assessment, student engagement and promoting a culture of belonging, and also diversity and inclusion. And I suppose these 5 modules, they're saying, should be kind of the baseline, or what we're looking for, the foundation around the country of people to be able to do these. And then you can supplement them with other training programs, obviously, as well. And there will be specific training programs per discipline too. So how to access them, and these slides will be shared afterwards, is that you can access them through the website of the National Forum for the Enhancement of Teaching and Learning. You have to register, but access is free, or they're also available directly through the Practice Education website in TCD. I just have the next 3 slides are just to tell you a little bit more. I just cut and pasted bits from it just to show you. It talks about, and I have the reference at the end, teaching skills are an identified factor in being a good role model. So if you're developing good role models on sites across HSCPs, teaching skills will be part of that. And for some people, then it's breaking down that further as to what they are. So again, this is just taken from that course. We'll be looking at what is an effective clinical teacher and how can we ensure that we're increasing the quality of the placements that are on offer to HSCP students around the country, and how we can support educators to build up their skills within this. Again, a lot of us, depending on the discipline that we're coming from, as we all know, there's 26 different HSCP disciplines, but we might have in-depth training in the professional knowledge and skills and about competency in our own individual discipline, but not everybody has received training about how to be an effective teacher. So I like within this course that it talks about being a facilitator, a teacher, a provider of feedback, a supervisor, an assessor, and a role model. And again, there's loads of information that breaks those down separately as well. Just the last thing I kind of cut from it as well was with regards to giving feedback. And sometimes over the years, to me, it was mentioned by educators is, okay, I can teach, but I find it difficult to give feedback. Again, it gives very different structures and toolkits for how people can do that. It talks about the sandwich model, the Pendleton model, and the Hattie and Timperley model. I don't have enough time to go through any of those here today, but it's good for you to know that, you know, people are yourselves or staff that are working in your services can go and find out more using these resources. Then lastly, the last tool in the toolkit is the Practice Educator education modules that are available on HSE Land. And again, not everybody knows that they are there. So a lot of people go on to HSE Land to do their mandatory training courses, not realising that there's 5 different modules available on that under the HSCP hub. So there's a module on education, supervision, assessment and evaluation, professional practice competencies, and also management and administration. These modules are not as interactive as the ones on the previous course I mentioned, but there's still like a wealth of information available within them. And to access them again, you have to go onto the HSCP hub, you have to go to education and research, and then you go to Practice Education tab, resources for educators, and they're there. And just what I've highlighted there in yellow at the end is it's important as well to note that all videos were made about the quality framework for sustainable HSCP practice education. And all of those videos are uploaded there on the HSC Land hub that you can avail of and have a read of. So finally, come to my last slide. As I started off with saying how you eat an elephant, and you know, sometimes it's one bite at a time. So it's good to remember that if you have a plan or a framework to help you, it'll make biting the elephant easier. And also if you have a toolkit, that's going to help you to do it as well. Because sometimes what can seem completely unsurmountable can be broken down into small chunks. And as we've all said, I think on this call, we're trying to do this as the first step in us developing, you know, a better structure for building capacity and quality for placements. Thank you.
Thanks very much, Olivia, and loads of resources there available that clinicians might not be aware of to help them become more effective teachers. So finally, we have Debbie Boland going to speak. Debbie is a physiotherapist working in primary care with a special interest in practice education, and she's going to discuss identifying regional training needs to build HSCP practice education capacity.
Hi there, thanks for that, Nessa. As you said, I'm Debbie Boland, physiotherapist working down in primary care in County Mayo. And today I'm just going to lead you through a Slido that we're going to complete, all right? And just checking with you, my slide's up all right, is it?
Yep, they're there.
Perfect, okay. So I'm going to lead you through it. So just no panic at all. But if I ask, if there's people on a shared computer, if we can ask everyone to complete the slide as individuals, so we just get a better results spread. The QR code you can scan with your phones if you've got them there with you, or you can go onto slido.com and enter the hashtag number that's on the screen there. Now they're going to stay up on each and every screen. So there's absolutely no panic as we move through the Slido about being left behind or anything like that. The results of these Slido questions will be shared with everybody on this today, and they'll obviously also go back to Catherine and her team and the HSCP there for feedback towards management in developing practice education. Yeah, so I'm going to move you through each of the questions there. Okay, so our first question that comes up, now this is a ranking question. So the first question is, how is practice education capacity developed within your service? So there's 5 options, and if you could just rank them in order, it would be great. So the first one option is there is no practice education within our service. The next one is as discussed at staff meetings, personal development plan meetings. The third option, my workplace offers practice education training. The fourth one, working with a practice educator, tutor, regional placement facilitator, or work with an HEI. So just if we can get people just putting up their results there as they go through. We'll just give you a couple of minutes on that one before we go on to the next slide. Just giving it a few minutes because by the looks of it, there's 146 people on the call and we're getting our numbers going up there. So as I said, we will share these results afterwards. And if you get left behind at all as we go through, you'll still be able to complete it. And I suppose we can see there as we look at it, the first one coming up in terms of ranking as working with a practice educator tutor. For us now, it's actually switched, discussed at staff meetings, personal development plan meetings. Yeah, so I'm going to take you on to the next question for those that are ready, but it's obviously still going to be up there on the screen. This question takes the format of a word cloud. So we're just asking, what practice education topics would you like HSCP webinars to cover? So some of the areas that are often covered on student education, whether it's feedback, as was just mentioned on the last presentation, especially how it comes up there straight away, the use of assessment forms, other tasks, anything you like. Obviously, if you just keep on putting them up there on the word cloud, we'll give you a few minutes just to complete that. And it's amazing how feedback comes up there as the biggest one and the biggest letters. Clinical reasoning, assessment forms. Time management, time commitment. It's amazing how there's a lot of the same things come up just with slightly different words. So they say, we'll obviously be able to share this with you, but feedback is still staying there. But put up as many words as you want, by the way. I should have said that, sorry. It's just so we can get an array of topics that we'd like covered. Yeah, and then I'm going to move the slider onto the third and final question for us. So this is a multiple choice question. You can select as many answers as you feel are as applicable in this situation. So what support can we provide for HSCP practice education training? You may say nothing needs to be done. Online training sessions, in-person training days, or a resource library. Or obviously, if there's any other questions, comments to make, don't forget the chat feature, the question and answer feature, sorry, on the actual Teams, and those will go back in as well. And we'll just give us all a few minutes to complete that. I suppose it's interesting to see at the moment the most popular option is the rolling series of the online training sessions. So what I'm going to do, just in the interest of time for everybody, is I'm going to close that from the screen. But as long as you've got the QR code or the slido.com, you'll be able to still enter the results onto that for the moment. So I'm just going to stop sharing my screen in preparation for going on to the final part of today's webinar, the Q&A session. And thank you for your attention.
Thank you, Debbie, very much for that. So we'll get lots of interesting and useful feedback, hopefully, from that, and it will help us shape future webinars for you all over the next, I suppose, coming months and even years as it is. So just looking through the questions there, people can continue with the Slido if you haven't completed it. And I also have posted just in the chat a QR code there. So if anybody, we welcome you, all of you, to actually complete it, because your feedback and ideas will definitely shape what we're going to do. So it's really important for us to be able to support you, that we understand what you got from today's webinar and what your interests are going forward. So just, there's been some questions, and I think, Catherine, you've been answering them as we've kind of been going along, but is there anything you'd like to elaborate on with regards to how the professions were chosen? There was a question there in the beginning from Aidan, I think, with regards to it.
Yeah, thanks a million. I think we have answered kind of most of the questions. So, I mean, if there's any other questions, just please type them in there. I guess the big thing to say is that those prioritized professions, I mean, one that actually doesn't reflect the full expansion in HSCP student numbers. I should have said that. So within our area, like clinical measurement physiology has expanded its student intake. But that was really decided at the government level, those kind of 8 kind of professions. And there's a real focus on disabilities. It's been quite challenging over the last number of years to staff the disability teams. So there's a big focus on increasing our staffing levels within those, and the disability services have really been kind of prioritizing providing placements. And we believe that's had a positive impact on staffing levels, because staffing levels have improved within disability services over the last 2 or 3 years. There's obviously also a big kind of focus on diagnostics. We know that nationally they're looking at kind of, I suppose, the extended working day and kind of weekend working. So there's a big kind of focus on staffing levels that are required around that, and that'll be part of the drive for looking to increase the radiography student numbers as well. Oh, you're on mute there, Anne-Marie.
Thanks, Catherine, for that. I think there was some other questions just around resources and where to source those resources. So I've put in a link for the Teaching and Learning for Clinical Teachers, that National Resource Hub. But I think Olivia's presentation will circulate afterwards. We'll have further details on training that's available there as well. There was a question just regarding simulation. Has simulation-based education been explored by HSCPs with regard to further developing our student capacity?
I think, Anne-Marie, that's something, like, as we engage with the universities, it's something we need to be kind of looking at, more opportunities for doing that. That is probably being led out by the universities a lot. So speech and language therapy has kind of very much kind of, embedded looking at kind of simulation in its practice placements, but obviously that can't be a replacement for students also getting the opportunities to come out to our services and kind of meet our staff and kind of, interact with kind of patients. So I suppose it can be a method of preparing students, for their placements, but it's not a replacement as such. But I do think we'll have to look at, lots of ways to kind of develop capacity and look at new ways of working, and simulation will kind of be a tool in that as well. I don't know, Anne-Marie, if you've got anything from your experience that you'd like to add to that, or Olivia.
Yeah, I'd agree. From my own experience, I think simulation can be very useful and helpful with ideas, but it won't replace completely what practice education on the ground clinically can deliver. And as well, there's some core, I suppose, regulation issues as well in terms of the amount of simulation that's allowed and that. So there's lots of work ongoing. It's very promising. It's very positive, and it definitely can be helpful in supporting people on the ground. Ensure that students have the, I suppose, the competence and the confidence in delivering it. in care. Olivia?
Yeah, I was just about to say the point there about the CORU and regulations with regards to hours and where you can do your, the specific amount of hours. And I agree with Catherine. I suppose it can be helpful in preparing you to go out on site, but won't replace the actual interactions that you get when you're out with the team and that you're working out on site within a region. I just see a question popping up there about the practice education modules on HSC Land. They're available on HSC Land, and hopefully if the presentations are shared afterwards, I hope that I've given the steps to follow to get into them and find them.
And if anybody has any difficulty, they can just come back to me and I can help you with that. And as Olivia said as well, there are resources and videos up on HSC Land with regard to the quality framework for practice education as well. So it's all there under the hub. But if you have any difficulty, definitely just come back to me and I can go through it with you. So I think we're almost up. Our time is almost up. So just for me, I would just like to say a huge thank you to everybody for joining the workshop today and for taking time to prioritise practice education. There are lots of demands and there are lots of challenges to developing our future workforce. And we know that, and you know that better than anybody. And it is going to be difficult. It is a challenge, and it's only through supporting each other to meet those demands that it can actually happen. So really, please keep sharing your ideas and your feedback, because it will shape our next steps in supporting you. And by working together, hopefully we will help shape the students who are going to treat and care for patients in the Northwest region into the future. So thank you so much and have a great afternoon.
Thank you. Bye.